So glad you're streaming with us. Well, parents in some parts of the country are struggling right now to find children's Tylenol and ibuprofen after an early and busy virus season. Now, some stores are actually rationing their supplies. ABC's Ariel Reshef has the latest for us.
Shortages of popular children's pain and fever-relieving medications at some stores across the country as the tripledemic of flu, COVID, and RSV hits children hard, driving unprecedented demand.
It's so stressful. It's like everything all at once.
Families from New York to Colorado frustrated as they face those empty shelves. Retailers like CVS and Walgreens now limiting the amount of acetaminophen and ibuprofen products customers can buy at a time to prevent stockpiling. At this compound pharmacy in California, pharmacists say they are able to make the medication in-house if needed. Drug manufacturers and the FDA stopping short of calling this a widespread shortage, insisting instead there are constrained supplies and sporadic outages.
The manufacturers are producing 24/7, but they're also trying to distribute product in an equitable way so that one part of the country doesn't get all of it versus another. So that is why they've not been able to meet every retailer's order completely.
All right, and our thanks to Ariel Reshef for that. Let's talk more about it. Physician at Stanford Children's Health and ABC News medical contributor Dr. Alok Patel joining us now. So, Alok, if your child is sick and you can't get your hands on the medication that you need, what do you do?
It's a very common question these days, Kira. I think the first thing parents should do is try to look around to other pharmacies in the area. Call ahead. You can try generic versions of Tylenol or ibuprofen. They work just as well. Or in some situations, call your doctor or a clinic to look to see if there's other alternatives or if they have another place they can reach out. This is especially important for parents of kids who have very high fevers or parents of kids who have other medical conditions and need pain medications, such as autoimmune disease, cancer, or kids recovering from injuries. And it's important that parents do not hoard. That is not productive. That is not equitable.
Is there a shortage of generics right now?
You know, I'm hearing reports that there is a shortage, but that is morally based on demand. There is nothing we've heard so far that there's a supply chain issue. And what the manufacturers are reporting is that they expect to be able to meet the demand in the upcoming weeks, if not months. But I think here it's important for people out there to kind of modify their behavior and only buy what they actually need and to not have what I like to call fever phobia. You do not need to dump Tylenol into your children every single time that thermometer says they have a fever.
So, all right, let's think of worst case scenario. You can't find anything, or maybe you do have some ibuprofen left or children's Tylenol. You know, how much do you really need, right? How long can you wait it out? Is it better to take it at the beginning or wait and take it towards the end? I'm just thinking worst case scenario here, right? If somebody can't find it but has a little bit left and say their kid gets sick.
I like how you framed that. So there's a couple scenarios here. In some high-risk children, including babies under the age of 1 month, there is no decision here. You need to call your doctor right away if your child has a fever. In some kids who have a temperature, 102, 103 even, if they are fine, they're happy, they're eating and drinking and sleeping okay, you don't need to treat that fever. A fever is an absolutely normal immune system response. In some kids who have a fever longer than 3 to 5 days, who have an excessively high temperature, it's okay to touch base with the doctor as well and look to see what your options really are. Now, I get it. I am a parent of a toddler. If your kid is fussy and not sleeping through the night, that means that mom and dad aren't sleeping. And in those situations, it's okay to give your kid a pain medication or fever reducer to comfort them. But you can also try things like sleeping with looser sheets or a lukewarm bath to keep them comfortable. And never is it safe to give children adult doses of pain medications, aspirin, or a homeopathic or off-label medication without consulting a doctor first.
All right, good advice. You have a lucky little girl at home. She's got a doctor for a dad. She doesn't need to worry. Alok,
and she
thank
loves
you so
grape
much.
flavored Tylenol, so we have to have that in house.
That was one of our favorite too. Thank you, Alok.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.